friends, today we are going to learn about suturing. At the end of every surgical procedure, meticulous wound closure is mandatory. This is vital to the healing of the wound. Careful suturing of traumatic wound also helps in aesthetically healing of the wound. So, let's start. First, we need to understand there are certain things which we have to keep in mind prior to a suturing procedure. Let's see, some of the points are mentioned here also. First and most important point which we have to keep in mind, that the procedure is completed. We have to check the completion of procedure and remove any sharp bony spicules and smoothen the bony margins. Remove any loose tissue tags or non-vital tissue, as it may be a further source for infection in future. One more important point is we have to ensure complete hemostasis. Excessive bleeding may lead to any emergency condition. We should check the wound is approximated without any tension. If not, undermine the tissue to ensure tension-free closure of the wound. For a large wound and possible dead space, place a temporary drain prior to the suturing. Now let's see how the wound closure can be done or how it should be. First of all, we should keep in mind the wound should be closed in layers. When the incision passes through multiple layers of tissue, it is essential to close such a surgical wound in layers. Otherwise, the deeper layers remain unapproximated and open, thus allowing dead space for the collection of hematoma. So, during the wound closure procedure, we have to approximate periosteum first, which is followed by masseter muscle, platysma, subcutaneous tissue, and it should be done with non-resorbable suture materials such as silk, ethylene, proline, etc. Subcutaneous layer suturing is to be done meticulously. Usually, subcutaneous and subcuticular layer suturing is done by placing inverted or buried knots. Inverted or buried knots. It is important that the knots and suture material are not exposed to the exterior on the skin. This is because it will lead to bacterial contamination and tracking of infection into the deeper layer of the wound. So, we have to approximate the wound completely and never the knot should be exposing outside to reduce the chances of infection or contamination. So, as we have said, layered suturing is preferred. So, why layered suturing is preferred? There must be certain advantage for the layered suturing. That's why we are mentioning this. So, let's see what are the advantages of layered suturing. The first and most important advantage of the layered suturing is that the approximation of wound in such a way tension is equally distributed. If we do layered suturing, the tension is equally distributed throughout the wound, throughout the various layers, and this will minimize the dehiscence of the wound. Decreased dead space due to good approximation of tissues and hence less chances of accumulation of tissue fluids. Because in layered suturing, the approximation is very close and very good, so that the chances of dead space is very less, so that it won't allow the accumulation of tissue fluid and blood in the areas opened up by the surgery, and this will further minimizes the wound infection. In cases of fractures where the bone plates or wires are placed, Closure of the periosteum over the hardware minimizes the risk of dead space, infection and plate exposure. Also, in areas where cosmetic closure is preferred, uniform distribution of tension along with the wound and subcutaneous closure helps in minimizing the scar. So, if we want the scar should be minimum, then we have to do layered suturing. It will help in that also. Now, let's see what all armamentarium is required for suturing procedure. Suturing either extraoral or intraoral wound, following instruments are required. First of all, needle holder. These are available in different types and sizes based on the region where these are used and the thickness of the suture material being used for suturing material. The second one is suture material. Suture materials are also available in different types depending on the region we are using. These are also of absorbable and non-absorbable type, and we will learn about these in next slides or next videos. Suturing needle. We will learn about suturing needles also in our next video. Suturing needles are also present in different shape, size, material according to the use, which we will learn in another video. Tissue holding forceps. It can be toothed or non-toothed. And the last is suture cutting scissor. We need a scissor to cut the suture, na? Otherwise, how we will be able to place a suture and remove it? I hope everybody must have understood till now. Further, we are going to learn about suturing needles and suture materials in different video. Stay tuned, subscribe to the channel for further updates so that you can get the video as soon as I post it. Thank you. Thank you for watching my video. Friends, if you like my video, please subscribe my channel and ring the bell icon for latest updates.